Hi, my name is David Drake. Welcome to Spotlight of Digital Innovators. Today we're going to talk to iTS, an endoscope with fluorescence technology and patents by Dr. Lee from Korea. And I'm pretty excited about the imaging that has been enhanced with the new technology. Mr. Lee and Dr. Lee, thank you for coming all the way from Korea. Good to have you here.
Thank you for inviting me here, and I thank God to be with you here.
Now, it's very exciting to see what you've accomplished. You're very young. You're the only one at the state university in Korea, the Seoul National University and Hospital, to get the first investment from them to go into your technology. And as I understood from as we got to know each other, you want to bridge the miscommunication between doctors and engineers.
Yes, right.
And you created a technology which is highly focused imaging in color, but also with fluorescence light. How does the fluorescent light help?
Uh, Actually, in operation, in usual situation, doctors can see the visual image, only visual image, and for junior doctors, they cannot see, they cannot know easily about the position of a vessel
Ah,
and position of a lymph node
right.
and even position of cancer. So they cannot easily know that. But with our device and our technology on the uh, near infrared imaging, we can real time we can we can visualize the position of vessel and lymph node and the even partly cancer.
And tumors.
Yes, tumors.
Well, that's important because we have some graphic images, and you're right. If you're just starting out as a doctor, you don't know that if you cut a little to the left,
Yes,
like in the liver, it could bleed out and die.
yes, yes,
And for other doctors to teach, how are they going to do that except you have images?
yes,
The imaging till today, I thought was much further advanced than it is what you created. But you're allowing the fluorescence to identify the blood veins
yes.
and not nicking or making a mistake. Fascinating, and you're mixing now electrical engineering
Yes.
and becoming the bridge to the doctors, because the engineers don't understand what happens on the floor when they're operating,
Yes, right.
and they don't talk to each other.
Yes.
And you become the bridge then.
Yes.
Oh, how did you realize that was important?
Actually, I thought that the Korean clinical technology is one of the best in the world, right? But the Korean medical industry is not the best and is actually is low. The reason why in this phenomenon is that there is no interaction between doctor and engineers. In Korea, engineers develop medical devices by themselves and give it to the doctors, and doctor denied to use it.
Right, and because they didn't ask them how functional it is.
Yes.
I've seen other technologies in the medical field where certain things have to be done a certain way to be practical, and that's the bridge you're doing here.
Yes. I realized that that's the core problem, so I decided to medical device business with Seoul National University Hospital, and I got the first I got investment from Seoul National University Hospital, and that's the reason why I can do interactively develop the medical device with them.
That's exciting. And you have a multi-hundred-million-dollar company now, at a very young age. Very impressive.
Yes, thank
And
you.
we've shown some images. They might be a little graphic, but it shows how clear it is versus the old images.
Yes.
So for the young doctors, it's very efficient for them to learn. And I also noticed that in the medical field, doctors want to show the rest of the world what they accomplished.
Yes, right.
And without this imaging, it becomes difficult, especially where you have intravenous and very difficult areas to reach. This camera becomes superior to anything else out there.
Yes.
And right, if I understand it correct, you can combine this endoscope with operating machines and run them together
Yes.
in real time and see in different ways where the veins and damages is.
Yes,
It's
right.
great for tumors, right?
Yes.
What else is it good for?
Actually, first of all, it reduces the failure in operation.
Yes, it
You know that
reduces the failure.
If a young or older surgeon cut the vein vessel by their mistake, and older surgeon get together and open the body and
Suture it, putting it
suture
together.
it. And
Well, that's an emergency. The client will die.
yeah, so our device can reduce the cases like that, because our devices visualize the vessel in real time. That's the first advance of our device, and the second one is it reduce operation time.
Okay, explain that to me, please.
In some cases, patient cannot receive laparoscopic operation because his liver cannot bear the long surgical time.
Oh, you're right. The liver is not going to be able to handle it that long.
Yes, in that situation, if surgeon clarify fast the vessel, then the vessel and lymph node and or tumor, then the operation time would be reduced much compared to the general laparoscopic surgery.
Well, today, what is the percentage of people manually doing operations and doing operations mechanically?
In developed countries such as America and Korea, 10 to 20% of patients got open surgery, and all other 80 to 90% of patients got laparoscopic surgery with endoscope, and nowadays even neurosurgery and gastrointestinal surgery and hepatobiliary surgery, and all of the surgeons try to change the operation weight from open surgery to surgery with endoscope.
So it becomes more and more traditional in the developing countries to go more mechanical with machinery to do the surgery.
Yes, right.
But then on the other hand, not everybody is very good with a joystick because a lot of them do it, with joysticks to do the operation. Isn't that correct?
So in some cases, and some companies try to apply the joystick in operation, but the AI technology and the automation technology on operation is not matured, so it just tried, but not applicable to clinical situation.
Well, right now, you might also be working with a lot of technology companies. Like you mentioned just now, artificial intelligence. How would artificial intelligence and big data out of Korea help the industry?
In Korea, Korean hospitals have much of data on health checkup and operation imaging. So they want to provide us the data for enhancing their clinical technology and medical device in industry. But and we also vice versa, we also want to receive their data and make better medical device with the AI technology, but there is some regulation to block this interaction now.
Well, Korea is big with Samsung and LG, microchips with Intel and AMD. You're using a lot of, you're putting together your own machinery, and you streamline the process to get the machine ready to go, but you also can customize it. Isn't that correct? And that would help existing machinery and existing hospitals to maybe reduce their cost and get more, maybe better camera. Is that correct?
Yes, actually, we are planning a health checkup center without medical staff. It means that there is a bunch of medical devices for health checkup, and patient itself measure their biosignal by themselves. It is maybe in 5 or 10 years it is possible. The situation could be possible by AI technology, and in this situation we need the help of a big tech company referred by you, such as Samsung and LG and something like that.
But right now, the industry in Samsung and LG in the healthcare industry is not as big as I thought it was.
Yes,
So you're at the forefront in Korea in what you're doing.
that's right.
And you have some growth plans to go, and I hear in the U.S. And maybe one day we'll see you go public, maybe in the U.S. Tell us about your growth plans.
First of all, we are now establishing Chinese joint venture in China as a sales channel and development R&D center. By this, we will extend our market to China first, and then actually on the other side, we are planning to buy the items researched by researchers. It is many researchers are doing their research with the local hospital and local medical staffs, and they have good network already, right? And I plan to buy the item and buy the IP. So I will make U.S. medical device company in 1 year, maybe. Now we are get ready to establishing the business.
Well, I like your strategy that you shared with me before. You created the business in Seoul, got the recognition of your fellow doctors and the university with the investment that they gave you. Now you already have these machines working globally, quite a few in the US and in Korea. And they've been running for a while, not just a couple of months, but a while with statistics. So researchers like it, people monitoring what's happening with disease, surgeons like it. And going after the US market first, getting approvals here, which you already have, allows you to show the rest of the world, the US is using my machinery. And I'm bridging the technology to the doctors, and it's helping their life and helping the people's lives, saving lives, reducing injury, helping students to see what other people are doing around the world.
That's right, and that's my hope.
And you're accomplishing this because, I've been involved with a couple of association ophthalmologists and other groups, and there is a pride with doctors to show the rest of the world how they do their procedure.
That's right.
And they want to show it. And everything internal that's being done right now, your technology would allow to show it with these images, how it is actually done and what they're thinking. And they can comment on what they're doing in real time and how they're cutting or removing or suturing. And I think that bragging right, potentially through social media and associations by language, by region, by vertical, by industry, is tremendous impact if they can start using your technology. Because the images that we are showing, it's completely different. I mean, some images in the technology, you see nothing almost. Other ones are just blurry or gray and white. You have several levels of different ways of visualizing what's happening.
Yes.
Now, what have you thought about doing on the social media side to get to these associations and these groups of doctors? Have you given that some thought?
Actually, uh, uh, yes, you're right. Doctors working with me, they want to show their work and show their work of very difficult surgery. By showing the completion of difficult surgery, they can be very famous, and their field their field uh, their field think him as a very skillful doctor, and they like it, and we are helping them to showing their skills in operation, and we providing very good recording technology in operation. So yes, but we cannot directly upload the video clip in social networks, but we are helping, and we are helping their recording and the analyzing their analyzing their operation. And if they request us the quantitative numerical things, such as near infrared intensity of near infrared and reference of near infrared red image, and we can provide it, and we try to respond fast with their request.
Well, obviously the hospitals and the universities have training classes.
Yes.
And have students.
Yes.
And their doctors are going to be wanting to record what they're doing so everybody can learn faster and better.
That's
to
right.
See the practical work.
Mm-hmm.
I think that's going to accelerate the young doctors become more experienced.
That's right.
And some young doctors going to, accelerate faster and maybe even come up with some, brilliant solutions themselves.
Yes, it's correct. The doctor working with me is he promote the training course, and in that training course, there are students from Saudi Arabia, and Russia, and U.S., and Japan, and China, all over the world come to Korea, and they learn how to do the operation with the fluorescence endoscope, and they can train the surgery with the additional information such as vessel, lymph node by our device.
Yeah, it reminds me that I had a friend who actually helped sell pacemakers, and he was very young because he got trained by one of the best pacemaker surgeons in the world. And every time he was in a surgeon's room during operation, the older doctors were always confused why the young kid was standing in the corner, and suddenly the doctor would ask a question, and he would give him advice on what he'd seen elsewhere. Because it was before these cameras that you created existed. So he had to learn from the floor and his own doctor, and then teach people senior to him 20 years older. And he always told me that they were shocked. Why is this kid in the corner telling the doctor 50 years old or older, who's an expert, what to do? Because he sold a pacemaker. He understood what the complication could be, what's the best method. And this is exactly what you are enhancing. You're enhancing that bridge to get the younger and older generation faster, reducing incidence, increasing likelihood of success, making sure you remove the whole tumor, because many times you can't see everything. Black and white certainly not, color sometimes not, because just too busy, too much in your way. And it makes a lot of sense now. I thought this was solved a long time ago, but from the images we're seeing, it's like it's a world difference from one way to another. Maybe you could tell me also a little bit about your own background. What inspired you to get into this? And when did that start?
When I was a student, I just like to studying electrical engineering and physics, something like that.
My father was an electrical engineer too.
Yes. And uh, actually, I want to I want to earn money with the very good way. So so I wanted to contribute to the human race, and I want to provide some benefits to the poor people and the people who people without medical services. That's why I decided to major the medical device in doctor course. And you know this is only for my case. And 4 years ago I opened the medical device business, and for 4 years I enthusiastically worked to make this business successful. But for the first time, the uh, before 2 years ago, I thought that too big money is meaningless to me, and also too big money can ruin me. So I decided to work without the thought on the big money, but I decided to work on the make making a very good medical device on the low price, and they provide it to the worldwide. And finally, the ultimate goal for me is providing uh, the people without providing the medical device to people without medical services, such as Africa. That's the calling to me given by my Lord.
No, I like that. You know, you get inspired to help humanity improve people's lives, and it becomes your legacy. This is your legacy to the world that you actually created this. But as I know with a lot of companies and startups, you have to innovate continuously. And just because you have a product now, you're probably already working on many other solutions to the extent that, like I said before, you might be selling just a camera with ITS name on it, or maybe another component. And also, you do have a lot of clients who have customized demand, saying that, well, we might need it a little different. And you are able to put the electronic engineering to work and create these products custom made. Um, Now I know you're having conversations to sell thousands of these. So you have already several $100 million valuation as a company, which is backed by the university and the hospital. So it's quite exciting for you. I would think that potentially having you go public on Nasdaq or New York Stock Exchange would be something that would be high prestige, and also something we would love to have a company like yours accomplish in New York. Now, I understand you're also going to be planning on, but you have to build a team, you have to create the sales structure in the U.S. to get to the hospitals. You already are in a couple of hospitals in the U.S. where the device already being used for a while. You get permits to have your equipment operating here in the U.S. I think that'll give recognition globally. But you mentioned before, you're not only focusing on the U.S., other markets too are your focus.
I will tell this question like this. If I think the region is no matter. So if some doctor or some hospital want my device, and I can do business with them in any region.
Right.
Mm-hmm.
But I mean, you are going to go after China as well, and early on, and have a focus on China and the U.S.
Yes, yes.
You know, it's going to have to be in the process.
Actually, the China is most fastest growing market, right?
Oh yes, I would think so.
And U.S. is the biggest market. If I go into the the this these both market, I can stabilize my business first, and I will advance to other region. That's the way. That's the way that I thinking about stabilizing my business first, and spread out to the other worlds.
No, thank you for sharing that. That's good to understand how you're going to roll this out, and it takes time. Now, you had filed patents for this company as well,
Yes, yes.
and how long did that take, and how many patents did you file?
It's about 100 patents in our company.
Oh wow.
It's about 100 company, and I said that I said this before. The first thing I want to make it successful is the fluorescence endoscope itself. But this is the process. My ultimate goal is make business to the doctor. I mean, I want to, if this business is sustainable, doctors must participate to my business plan, and I have to make their idea realize. I have to realize their ideas to the business. So my plan is make them of good business with their idea. That's why they came to me and make patent trees. Mm-hmm. We have already 100 IPs, but about 14 doctors come to me and make patent trees.
Additional, okay.
Yes, the number of patent will be grow faster in a year. Maybe in my thought, maybe 50 a year. 50 a year.
50 a year.
Additional IP would be produced.
So you see, you already created a legacy.
Yes,
Dr. Lee, you created a legacy already because you inspired other doctors to create patents around your patents.
Yes, I urge them to make your ideal IP with my company, and they agreed to make IP, and they decided to make their business with their idea, and I promised to provide them for make investment and making prototype.
Oh, you helped them.
And mass production and sales networks, and I promised to provide it, and they'll work. Only thing to do is announcing their product to the in the conference or convention.
Well, you have created a beautiful company. You worked very hard, I understand. Mm-hmm. So, Dr. Lee, thank you for joining us today. And I'm excited to see how you're going to grow your company over the next year and participate in watching out for how that grows for you. Thank you.
Thank you. Thank you for inviting me, Mr. Drake.
Thank you. My name is David Drake, and this is Digital Innovators Spotlight. Goodbye.